2 minutes, and we want all board members to please govern themselves accordingly as we prepare for the meeting for mic checks and/or any other pertinent needs you may have, dissemination of information, and to the audience as well. We will commence in 2 minutes. We would like to call to order our board work session, May 18th, 2021, for the Lynchburg City School Board. And as we call our meeting to order with our quorum being established, we do want to, at this time, share with the board that via conversation with our board clerk and Elizabeth Ewing from VSBA regarding utilization of board docs for voting, that at whatever point we get to that, we can utilize it, but it cannot be used as a vote to interact with the public, to be able to hear and see our votes in the proper way. And with that being said, without it having to be announced again, if it is the pleasure of the board, I would like us then, realizing that it would be redundant to do that and then announce it again, that we would simply consistently throughout our board meetings use a clerk calling of the roll for all votes, which would then not determine whether one vote is important over the other vote, that they were all votes, even approving the agenda, would call for a very quick roll call of the clerk, yes or no, or whatever the appropriate way that the particular motion would call for you to affirm your voting. And so I just wanted to establish that. That would mean that every time we vote, whether it's the approval of the agenda or any item on the agenda, it would be the clerk calling the roll and not having one thing done that way and something else done another way. If there's no feedback on that, I would like at this time to entertain a motion from the board to approve the agenda that you have before you tonight for our work session. Is there a motion? Ms. Morrison is making the motion. Is there a second by Dr. Gupta? Any further questions or discussion? Madam Clerk, if you could please call the roll.
School Board Member Evans?
Yes.
School Board Member Morrison? Yes. School Board Member Dr. Carter?
Yes.
School Board Member Dr. Brennan?
Yes.
School Board Member Dr. Coleman?
Yes.
School Board Member Dr. Nellis?
Yes.
School Board Member Dr. Sinhai?
Yes.
School Board Member Dr. Gupta?
Yes.
School Board Member Mr. Harvey?
Yes.
The vote carries.
Thank you, Madam Clerk. At this time, we will stand for our Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, members of the board, and to our public. As usual, this being a work session, there will be no public comments tonight, but we do want the public to know that via Comcast Cable Channel 17, you can view meetings later, and LCS YouTube channel is available now, and all matters pertaining to our meeting tonight are featured on board docs. Thank you for that. At this time, the chair would like to entertain a motion for our consent agenda, and I do want to acknowledge that in our last meeting, we did request for this matter to be placed on the consent agenda for tonight's meeting. So I'm seeking board approval to change the dates for spring break from April the 18th through the 22nd to April the 11th through 15th, 2022, to allow additional instructional time to review and prepare for state and national testing as discussed at the May 4th, 2021 meeting of the school board. Is there a motion to approve the consent agenda?
I move that we approve the consent agenda.
Been moved by Dr. Carter. Is there a second? Second by Ms. Morrison. Any further questions or discussion? Hearing none, Madam Clerk, would you call the roll?
School Board Member Evans?
Yes.
School Board Member Morrison?
Yes.
School Board Member Dr. Carter?
Yes.
School Board Member Dr. Brennan?
Yes.
School Board Member Dr. Coleman?
Yes.
School Board Member Dr. Nillis?
Yes.
School Board Member Dr. Sinhai?
Yes.
School Board Member Dr. Gupta?
Yes.
School Board Member Mr. Harvey?
Yes.
The vote carries 9-0.
Thank you, Madam Clerk. At this time, we will now move to Section D of our work session agenda, and we do have our school board member reports standard, whether you report or not, and we'll just swiftly move through those. First, item 1, Finance Committee. Harvey?
No, sorry, no report, but we do have our meeting on Tuesday, May 25th at 3:30.
Thank you, Mr. Harvey. We will be hearing from Mrs. Bell Evans and the Legislative Advocacy and Community Relations Committee during our agenda items, and so I would presume, Ms. Evans, that we'll wait. Very good. All right, item 3, Governor School Committee, Mr. Harvey.
Yes, the Central Virginia Governor's School Board met on Wednesday, May the 5th. We had 3 of our members present, so we had a quorum. The main item of business that we discussed at the meeting was the addition of 6 additional slots for Lynchburg City Schools, with the provision that Lynchburg City would send students. It was confirmed that if we do not send a full roster of students, we would not be obligated to pay for any of those specific slots. Also, Dr. Smith acknowledged that he would be attending one of our upcoming meetings.
Thank you, Mr. Harvey, and I know there was robust discussion at the last meeting, and we will be looking forward to Mr. Smith coming at a later point. Any questions or discussion for Mr. Harvey at this time? Thank you, Mr. Harvey. Laurel Regional School Board, Dr. Carter.
Okay. The Laurel Regional School Board, which the acronym stands for Lynchburg Area Unit for Regional Exceptional Learners, we met May the 5th at 10 o'clock via Zoom. And the action items we approved were the budget for this year, coming year, and also the calendar. And we also thank the interim superintendent for the Bedford County for being there on our board, and we're looking forward to having the new superintendent of Bedford School to run our school board, the regional board. Another announcement is the Laurel graduation will be held at the Laurel Regional School, 401 Monticello Avenue, May the 27th at 6 o'clock. And we do have Lynchburg City School students there that are graduating.
Wonderful, wonderful. That's what we all wanted to know. Thank you, Dr. Carter, for your report. Any questions, discussion? Thank you so much. At this time, the STEM Academy, Dr. Nillis.
No report.
Thank you, Dr. Nillis. And our task force, Susan Morrison and Atul Gupta.
No report.
Thank you, and we know that will be presented to us when there's pertinent information to share to us. Thank you. We will now move to Section E of our agenda, where we have 7 items tonight, and we certainly want to be clear, concise, and as coherent as we can be succinctly as we go through each of these items. And we will now ask Dr. Edwards to bring forward our discussion on return to learn.
Okay, absolutely. So thank you. And we have the short version, the work session version of Return to Learn, and I'm going to turn it over to Ms. Pugh to just go over Return to Learn update.
Absolutely. I'm going to ask Josh Boyd, who is the new principal of the LCS Virtual Academy, to share just an overview of what's happening so far with the Academy. And I believe he's with us on Zoom, although the dashboard is pulled up. So do we want to do that first?
We can do the dashboard first if Dr. Sinha wants to go over the dashboard since it's up.
Oh, okay. Well, not much to say. Vaccinations are moving along. We have about just under 40% who are not vaccinated. That's consistent with national trends. Hopefully that percentage will come down. The weekly cases is fluctuating up and down, but it's still quite low compared to its peak back in January. Testing is down, positivity rate is down. Age distribution has shifted a little bit, increase in cases among 20 to 29-year-olds, which I guess you'd expect. There's far fewer cases, but the distribution by age has shifted with vaccinations. Other than that, everything looks pretty good, relatively speaking. Hopefully numbers can continue to go down following national trends. We're sort of up and down, so we don't really have a trend.
Any questions for Dr. Sinha on the dashboard portion of Return to Learn? Thank you, Dr. Sinha, for your diligence. Dr. Edwards?
All right. So now we're going to ask Josh Boyd, who's joining us via Zoom. And as I mentioned, he is the new principal of LCS Virtual Academy, and he's going to give us a brief overview of what's happening.
Thank you, Ms. Pugh. First, let me say I'm excited and honored to be the principal of the Virtual Academy. I want to share a quick update with you regarding where we currently stand as far as student enrollment and hiring staff for the Virtual Academy. So currently we have 330 or over 330 students who have applied to attend the Virtual Academy for the 21-22 school year. These students represent all of our school zones within LCS, which is really exciting. As was shared in my video last week, we're currently working through our application review process, which is focused on assessing where each student currently stands in the areas of attendance, academic achievement, and engagement. We're collaborating with teachers and school counselors to provide this vital information on each student's progress in remote learning this school year. My goal is for families to be informed of their application status by Friday, June 4th, and we're currently on target to hit that date. Simultaneously, we're reviewing teacher applications, interviewing and recommending candidates to human resources. I'm really excited about the team that we're forming at the Virtual Academy. We will teach the whole student, we'll be forward thinking, and we'll go above and beyond to help all of our students learn. Thank you for putting your trust in me. I know that the next few months will be very busy getting our academy up and running, but we are up for the challenge.
Thank you. Does anyone have any questions about Virtual Academy? Yes, Dr. Brennan.
First of all, congratulations on your appointment as principal for the Virtual Academy. I saw the video that you all did last week, and it's great, and I'm sure it's going to be a successful project. Dr. Coleman and I had a conversation with a concerned parent today about the aspect of the students who are in the Virtual Academy being removed from the community of Lynchburg City schools as far as not being physically present in the schools and therefore separated and not having the experience that other students do, either extracurricular or drama or other areas. Do you have any plans or feelings about how those students will continue to be part of the Lynchburg City School community?
Yes, absolutely. So our goal is for each of our students who are accepted into the program to participate in extracurricular activities at their base school. So at the high school level, extracurricular sports, athletics, and other extracurricular activities. So that's our goal moving forward.
Good, thank you.
Any further questions? All right. right, Ms. Pugh, you can move to the next piece.
Certainly, thank you. I just wanted to go over some of the things that we sent out a few days ago, yesterday I believe it was, regarding some of the updates that came through at the state level. And so I just wanted to remind all of us that are listening that Executive Order 72, which is effective May 16th, this is guidance that's being given, from the state as well as from Dr. Lane, the state superintendent. Masks must still be worn by all staff and students indoors on school property for the remainder of the school year, so we will continue with that. Masks are still to be worn by students and staff on the school bus for the remainder of the year, so we will continue with that expectation. Outdoors activities do not require masks for vaccinated people, but we are still practicing social distancing. So we will continue to follow the mask policy that we have in place at LCS. And then there are some additional changes that are taking place with Executive Order 79. And I just want to remind that those begin on May 28th, I believe. Our email said May 29th, but it is May 28th that those take in effect. So I just wanted to remind all of our family members and all of our staff to refer back to that communication that went out. If you have questions, please reach out to us and we'll be able to help you with that. And I also have with me to give a brief update of our vaccination efforts as well as quarantine information. We have Director Brown.
Good afternoon.
Good afternoon.
Good afternoon.
LCS has approximately 1,576 employees. The school year has been unparalleled to any other school year. As a department, we have worked diligently to align guidance documents and to support the Centers for Disease Control and Prevention and the Virginia Department of Health initiatives to maintain a safe and healthy LCS work and school environment. One of the biggest undertakings of LCS this year has been the vaccination of staff and students. During the first week of January, LCS surveyed the 1,576 employees to see who would be interested in receiving a vaccination. Based upon this information, our LCS team was tasked with collaborating with the City of Lynchburg and the Virginia Department of Health to implement a plan. As a result, we were able to get the regional vaccination pilot clinic up and running within 3 days. The clinic started at E.C. Glass High School with the support of Mrs. Rose Flower, the principal, Mr. Jason Jabron, the assistant principal, and Greta Ford, the head custodian. Most importantly, we began to vaccinate our LCS employees and the City of Lynchburg staff. The final vaccination numbers and surveys are as follows. We had 1,408 employees who completed the survey, thus leaving 346 who did not respond. 92 employees were undecided or wanted the Johnson & Johnson vaccination. Those who wanted the Johnson & Johnson vaccination were notified when it became available last week. 913 LCS employees are fully vaccinated. There may be additional employees that received their vaccinations that did not notify our office. There are 57 staff that's partially vaccinated, meaning that they received their first dose, and due to various reasons, they have to receive their second dose, and our office is still trying to work with those 57 employees to get those vaccinations completed. In regards to student vaccinations, our LCS staff supported the City of Lynchburg and the Health Department when they held a clinic on April the 21st for 16 to 18-year-old students. In addition, we will provide support again tomorrow, Wednesday, May 19th, and assist with the vaccinations of 12 to 15-year-olds in our community. Based upon a parent and guardian survey that was conducted last week, we had 616 parents and guardians respond to the survey. 256 of those did not want their child to be vaccinated. 360 would like for their child to be vaccinated. As the CDC guidelines continue to evolve on a daily basis in regards to vaccinations, we will continue to work collaboratively with the Virginia Department of Health and the City of Lynchburg to meet the needs of our staff, students, families, and community. Lastly, for vaccination clarification, The individual is considered fully vaccinated 2 weeks after one dose of Johnson & Johnson vaccination, or 2 weeks after the second dose of either the Moderna or Pfizer vaccination. Once an individual is fully vaccinated, or if they have COVID-19 in the past 90 days, they do not need to quarantine for exposure. Reviewing our data for the last 2 months, we went back and we revised our quarantine and isolation guidelines. And for the last 2 weeks, we have implemented that quarantine or isolation may end after day 10 without testing, or after day with a negative PCR or antigen test performed on or after day 5. And so moving forward, we will keep that in our guidance until we receive further information from the CDC or other guidelines for us to follow as well. And just a reminder, our guidance evolved just like our guidance from CDC evolves, but we also look at our internal data, our community data, to make sure that we're doing our best to maintain a safe environment for our students and staff and community stakeholders. Thank you.
I believe that's it, unless there are questions.
Yes, Dr. Gupta.
I want to applaud Ms. Brown. I cannot see you from here, but for all the hard work you have done. I've seen you from my own eyes, and I think every board member has seen. She was standing on her feet for 8 to 10 hours a day, non-stop. And you were the woman responsible for moving people out in what, 1 minute and 32 seconds? Could you give the exact time?
Yes, sir.
You had it to nail down, and that was remarkable, so thank you very much.
You're welcome.
I have a follow-up question. How many surveys were sent? You received 616 responses.
We sent them to the entire LCS community. And so all families within LCS were sent the survey, and all staff as well were sent the survey.
Thank you, Dr. Gupta. Great, Ms. Evans.
I know that doesn't sound like a lot. I want people to keep in mind too, though, that like there was a vaccine clinic for 17-year-olds before Lynchburg. So I think a lot of people got their children vaccinated before the schools offered it. So I do think we probably have more than that vaccinated, but that really wasn't my question. For Mrs. Pugh, when we look at the practices we have in place for the summer, and we have summer school and we have sports over the summer, when they come in and use the weight room and all that stuff, will all of those be re-looked at according to the new guidelines? Because I know last summer the weight room for football was such a issue because it was so active then that it had to be very diligent about how we were doing it. I'm just wondering if those are going to be looked at again for this summer so that perhaps it would be easier to get kids in there.
Mm-hmm. Absolutely. We will certainly look at those. I'm positive that they have already begun to make plans for that, and they are looking at the new considerations, the new guidelines, and that will be updated. We will not stay with, what is currently there. Just as we've updated our instructional plan as well as our health mitigation plan, they will continue to update that as well.
Okay, perfect. Thank you.
Mm-hmm.
Thank you, Ms. Evans. Ms. Morrison, did you have a? Okay, Dr. Carter.
And Dr. Brown, as Dr. Gupta, and Mrs. Brown, as Dr. Gupta stated, yes, I wanted to thank you and your team for a wonderful job with continuing with contact tracing and everything when other departments or places stopped because it was so overwhelming, but you all kept on doing that. My question is, but you gave a number of the teachers or the employees that were vaccinated, fully vaccinated. What percentage of that is that of our total employees? Do you know? Are we confident with the number of employees that we have fully vaccinated?
Right, and I can get the exact percentage for you. I think we were around 74 or 74.6% in terms of vaccinations. We encourage all employees to get vaccinated. Of course, we cannot mandate it. Our greatest tool are each other. For example, I had a custodian at one of the schools to get vaccinated, And in response, that person's whole team ended up being vaccinated. And so it's kind of, decreasing the fear and debunking some of the myths and making sure that we are educating our staff. And it is a personal choice at this time whether or not the individual participates in the vaccination process at this point. So we will continue to encourage our staff to partake in the vaccinations in efforts to keep our schools open and not having to close classrooms or schools due to contact tracing because of exposures or positive tests.
Thank you.
Thank you, Dr. Carter. Dr. Brennan.
I just also want to reiterate my thanks, along with Dr. Gupta and Dr. Carter, for all the work that you've done over the months. This has been a long haul, and you and your department have really shouldered the weight of all the burden, so thank you so much for doing that. I have to say, on a personal note, I'm sort of disappointed the CDC kind of didn't do better, and I hope that with their new regulations for come out in the summer, they'll do better as far as outdoor activities. Now they're saying, as you stated, that you can only not have masks outside if you're vaccinated, so it leaves the children still wearing masks, which probably from a science point of view does not hold up very well. But the good news is that under Order 79, I know that a lot of us will be at the graduation on May the 30th, but those of us who have children graduating, it would be great not to have masks for those who are vaccinated. So that's really good news, and I'm glad the public will hear about that. And then my only question is, I sort of couldn't hear the last part about quarantine. Were you saying that now we are using the guidelines that if someone's exposed, they can be tested in 5 days with a PCR test, and if it's negative, they can come out of quarantine in 7 days?
Yes, sir.
Okay. Great. Thank you very much. Thank you for all your work and for all your care. And Ms. Pugh, thank you for your help.
Thank you, Dr. Brennan. Dr. Nilles?
Yeah, I'm real interested in what the plans are for sports over the summer, given where we are, as well as where you anticipate what school's going to look like. Are we going to go back to all the kids back to school every day? Is there plans in place for that? What,
Absolutely.
where are we going with things? And, I'm interested in hearing some specifics.
I don't have specifics for summer, but we can certainly get that to you as far as athletics and extracurriculars. For the fall, we will have the two instructional options, the LCS Virtual Academy, as Mr. Boyd just discussed. We also will have in-person learning 5 days a week. And right now, we will continue with masks. I believe we'll continue with masks in the fall, but social distancing is recommended and it's a guideline. But first and foremost, we want to get as many students back in school 5 days a week as possible. So we are looking at classrooms and the space that we have and how we can get as many students back as possible. And if we need to be closer than 3 feet, we will do that. If we can get students back in classrooms at 2 feet, we would certainly do that because the guidance for social distancing is just guidance with Executive Order 79.
And just to follow up on that, we, with our superintendent calls, and as Director Brown says, this changes rapidly all the time. Our planning for what will happen in August, since it's May, is probably going to change. We're probably going to see some changes coming from the governor. We'll see some changes coming from VDH, CDC. So if nothing else, we've learned to just be flexible, plan what you can, but plan again is how we're moving with it. But we are committed to the 5 days a week for all kids and offering the virtual academy program. Just like before with the sports, we kind of work in partnership with VHSL to sort of see what their guidelines might be in line with CDC and VDH, and we do not have any updated information on that as of now.
Yeah, and I appreciate that. The reality is there's a lot of frustration out there. It's clear the guidance, and this isn't really a criticism of administration, but it's the bureaucrats and the government. The CDC is notoriously conservative as being generous in terms of masking, and it was clear that wasn't needed for vaccinated people, and they admit it now. And certainly the governor is not ever going to admit that, oh yeah, your students are in school and you can take your mask off. And I just there's a lot of frustration, I think, with that. And I think us being, well, obviously being flexible, but I think taking that into account. I mean, sports, athletics, it's voluntary. People choose, it's a little different than some mandatory activity. And for folks that do have serious concerns, we have the virtual academy. So I think we need to take that into consideration too, that there are options and people are making choices. So, thank you.
Thank you, Dr. Nellis, and I'm coming to you, Dr. Dr. Sinha, did you have anything you needed to say to Mr. Harvey?
I just want to ask a point of clarification, because I heard Dr. Brennan say at graduation that adults who have been vaccinated since they're outside would not be required to wear a mask. But I believe I heard Ms. Pugh say that LCS policy is that we will continue to wear masks through the rest of the school year. So I just would like a clarification on what our position is going to be for graduation.
So there, in all of my SOUP calls, although not clearly stated in the executive order, so again, I have to take the guidance that I get from VDOE, it is a distinction between indoors and outdoors. So as Ms. Pugh said, for the remainder of the school year, where we're indoors and on the bus, were the first two items that she discussed, we will continue to wear the mask. For graduation, which is on May 30th, so after the May 28th Executive Order 79, and it is outdoors at City Stadium, so it is an outdoor event. So the vaccinated folks do not have to wear masks.
Okay, thank you.
Thank you for that, Mr. Harvey. Ms. Evans?
I just want to quickly say, too, I'm so happy that we will be back 5 days a week next year. And I recognize that it may be with masks, and I just want people to keep in mind, kids have done fantastic with masks. Being in school 5 days a week is way more important than whether we have a mask on, and I think as adults, we tend to forget that kids have risen to the challenge and are able to wear a mask throughout the day, all day. So I think our focus needs to be having them in 5 days a week. And if it's with a mask on, that's okay.
Well said, Ms. Evans. Anyone else on Return to Learn that has been inclusive of the vaccination update? Well, thank you so much, Director Brown. We could go on and on about the work that you have done. And thank you, Ms. Pugh, for helping us to understand where we are and where we're going, and I hope the public will continue to stay with us as we are excited about our students returning. I did have one question that you may have stated, and sometimes my ears are not as they should be, but was there any comment on when students 12 and younger would be vaccinated? I apologize if I didn't clearly hear that, if you already stated it.
The Director Brown did state tomorrow there is a clinic, I believe, go ahead. There is a clinic for.
Yes, there will be a clinic tomorrow at the regional vaccination clinic at Candler Station at the old TJ Maxx building from 4 p.m. to 7 p.m. You can just show up and we can schedule you there, or you can go online and register your child between the ages of 12 and 18 years old. And if a parent or whoever need a vaccination that comes with them, we will vaccinate that adult as well. So yes, it will be tomorrow from 12 years old and up. And it will be through Lynchburg City Schools nurses working with the city of Lynchburg to vaccinate our students.
Thank you, Director Brown. I'm glad I brought that back up because I'm excited in my chair to hear that, and I know that the public is as well. Thank you all very much, and we will now continue to move forward with item 3, Student Services Department Introductions and Overview. And Dr. Edwards, if you could set that up as well. Yeah, well, do that for me, please.
Certainly. As has been our tradition at our work sessions, we like the public to get an overview of the various departments that we have. We've been doing this all year long, and I am proud to bring up, again, Director Brown, who will introduce members of the Student Services Department, as well as give a brief overview of what happens in the Student Services Department. Director Brown.
Well, we're waiting on technicality. Director Brown is not able to share her screen, so I don't know if they're going to bring it up on the Zoom or if they're going to give her permission to share her screen. Here we go. Which one is it? This one? Yeah.
All right. I would like to welcome the board to the Office of Student Services. I call this office the office with the big golf umbrella, who encompasses many roles and responsibilities. My internal staff, I like to begin with the faces so that when you make those phone calls in, you know who you're talking to. So first up is my administrative secretary, Ms. Thomas. And she is new to the team. This is her second year on the LCS team for Student Services. Next up, we have Ms. Danielle Penn. Danielle Penn has been on about a month and a half, and so we gave her a hard welcome in by having her start at a vaccination clinic on, I think, day 2. So we welcomed her with warm arms, and she jumped right on in providing support. Okay. Next up, we have Ms. Daisha Womack, and she is one of our supervisors in the Office of Student Services. We also have Ms. Dominique Foster, and she's another supervisor for our office. In our last addition, we have Ms. Sherry Brown, who's another supervisor for the Office of Student Services. Under the Office of Student Services, we offer counseling services because we are over the counseling department. Also, anything in regards to behavior supports, referral data, any type of student discipline is within our office as well. We also house the school social workers, and they also work with our mental health division case manager. Also, we have our homeless liaison person who assists all the homeless families within the community. Also, we have truancy officers. So when students are missing from school, we work directly with the court services if needed, and we go out into the field and do home visits in trying to find our students, whether it's a runaway student, whether it's a child that has a CHINS petition in our need and services, or just a child that have dropped out for whatever reason. We try to go to the home and encourage our students and our families to come back to LCS. Also, under this big umbrella, we have our Jackson Street staff. And those are our truancy staff that I just talked about, and I got ahead of myself, so I apologize. My homeless liaison and my division caseworker, and Andrea Bryant, who's our nurse coordinator. So this office is also over top of all of the nurses within the division that are located at each of our 19 schools. In regards to additional services, we offer services to students that are seeking alternative routes to graduation. We offer the GED, and so we have a rodeo program that's housed at the Amelia Pratt Center for students that are ages 16 through 18. They can pursue their GED as an alternative way to get their high school diploma. Anyone that's enrolled into that program have to complete an asset program, which is inclusive of a transition plan. We want to know where that student will be going or enrolling to upon receiving their GED. We highly encourage a 2-year program a 4-year program, military, Job Corps, CVCC, World of Work. So we work with all of our students to make sure that after they receive their GED, that they're looking at that next phase of life. Also in that center, we have our adult basic education staff. So if a student turns 18 and want to go to the adult side to pursue their GED, they can do that as well. But we also house that staff there, so any community member that is seeking to get their GED, they can enroll in the adult basic ed program as well. Lastly, I already covered behavior support and social workers. So lastly, our umbrella is inclusive of alternative ed programs, meaning Empowerment Academy, Turning Point, Fort Hill Community School, and transition programs. We work collaboratively with these principals and directors to provide support and resources for their students there to recover credits, prevent dropout, or help them move onto that next phase of their educational life that they choose at that point. So when you say Office of Student Services, we carry a big umbrella because we offer a lot of support and resources to not only students, but families and also staff within our division. And I just gave you a little bit of the umbrella that we carry for our office. So, Student Services.
Thank you. And these are real people behind these names. Some of them we met today over at Paramount and other places, and so really incredible people. All right, then that moves us to our agenda item 4 under section E, SBAR presentation.
So as you can see, it's the Director Brown show tonight with several different presentations that all fall within her purview and supervision. Tonight's SBAR presentation is going to be on behavior. That will be followed by a short presentation from SROs, from Mr. Gatsky and Ms. Brown, and also the School Health Advisory from Ms. Sherry Brown. Also falls under Director Brown's leadership. So again, while she gets her PowerPoint together, I just want to let the community know that we spend time each work session introducing you to a different department and what they do, what areas they supervise, how they engage and interact with not only our schools, but also our community. And you'll get to see that tonight. Director Brown.
All right. Well, Board, I would like to introduce you to Ms. Dominique Foster, and she will be giving you an overview of the SBAR system and process.
I'm a little short. Good evening.
Good evening.
I'm Dominique Foster, and I'm going to give you an overview of SBAR. And SBAR stands for Student Behavior and Administrative Response. And all of this falls under the Virginia Model Guidance for Positive and Preventive Code of Student Conduct and Alternatives to Suspension. So the Virginia Department of Education has set out goals. The goals of the Model Guidance for the new Student Code of Conduct include creating a safe, supportive, effective learning environment, addressing the data inequities and outcomes for students of color and students with disabilities, reducing the approaches to discipline, developing behavior interventions and supports, improving school culture and climate, reducing referrals to law enforcement and the juvenile justice system, and overall improving our community. This guidance from VDOE is including and directly connected to the Virginia Tier System of Support, which is VTSS, and Positive Behavior Interventions and Supports, which is PBIS. Our behavior descriptors, which we know as discipline, crime, and violence, or DCV codes. Next slide. will now be replaced with the SBAR codes, so the Student Behavior and Administrative Response Codes. Starting this upcoming school year, 21-22. Can you go back? Yeah. Starting this upcoming school year, the 21-22 school year, all school divisions in the state of Virginia will be using the behavior descriptors from the model guidance, or SBAR codes. This model guidance describes student behavior without bias or criminalization. But the biggest thing what it does, it asks is what harm was caused and what caused the behavior. So that's the biggest difference now from DCV codes to our SBAR codes. Again, what harm was caused and what caused the behavior. This is just, again, kind of what I briefly discussed, the SBAR focus areas and what the state of Virginia and Department of Education was thinking when they went back to revise the Model Code of Conduct. So what harm was caused? Our behavior categories. Behaviors that impede academic progress, behaviors related to school operations, behaviors that create a negative relationship, behaviors that create a safety concern or cause a safety concern that make things unsafe for students, staff, and or visitors who may come to the school, and behaviors that endanger themselves or others, safety or welfare of either the students or others in school. So here are the behavior categories that we're going to be looking at when we say what harm was caused. How do we respond? We have leveled responses now. How do we respond to that behavior that was caused? Level 1, let's kind of figure out what's going on. What caused the student to behave in the way that they may have behaved? Level 2, let's dig deep. Let's get social workers, school counselors, behavior coaches, parents, everyone at the table at this point at level 2 to see what is really going on. Level 3, again, let's use every intervention possible or resource that we may have to find out what is going on to cause a level 3 behavior or our response. And this may include at level 3, short-term removal from school. Level 4, some level 4 responses will require a report to the superintendent or the superintendent designee, and that's outlined in our Code of Virginia. And level 5, these responses are reserved for those behaviors that require a referral to the superintendent or designee, and which may also lead to expulsion, alternative placement, school reassignment, or long-term suspension. So responding to behaviors. The model guidance outlines 3 types of responses to student behavior: discipline sanctions, instructional supports, and behavior interventions. What are we doing to keep our students engaged? How are we intervening? And what discipline sanctions are we giving our students? These responses will be collected in the state collection report that goes to the state every year as we do DCV codes. So these responses will be collected, but they are collected now under SBAR. So the model guidance overall just recommends that we look at what harm was caused and how we respond as administrators. And the last slide is a crosswalk and some resources that kind of outline the levels and the behavior categories. Thank you. Any questions?
Ms. Foster, you did an excellent job in presenting that to the board. Questions, discussion? Mr. Harvey.
Will, I assume level 4 and level 5 responses will be addressed still through our student discipline committees? Yes. So will we receive an update more on the SBAR codes and the cause-effect information that you presented?
Yes. So the process and procedure is still the same, except the codes have changed. So as far as having a discipline committee, all of those processes will still be the same. It's just internally our codes are changing of how we code discipline and how we respond to them.
Okay. So Ms. Brown will guide us, continue to guide us.
We started training, and Dr. Coleman and Dr. Gupta evidenced today when we were at one of the schools with one of our behavior coaches. So at first, we trained our our administrators. Now we're working on our behavior coaches, and so we're flowing that information down to train and make sure that all of our staff fully understand what SBAR stands for. And so we will also be working collaboratively with the Office of Curriculum and Instruction to make sure that the instruction is engaging, but also making sure that at Tier 1, meaning universal services and supports for all students, that the instruction there in the classroom management are all aligned in Lynchburg City Schools, and so that we're being preventative, so that level 2 services, Tier 2, we're doing more of that specific intervention geared towards specific students. So being more intentional in regards to instruction, in regards to intervention and supports that we are providing to our students, but also documenting it so that we can look at our data and refine our processes and our systems as we move throughout the school year.
Thank you.
So it's new, so just know that. So we might have some hiccups, but we're diving straight in, head first, and so we're excited and we're eager to get it up and rolling this school year.
Thank you, Mr. Harvey. Dr. Carter?
As I was reading through the levels, I was a little discouraged because it didn't include some interventions, but then I got to the responding to behaviors. But what I don't see here is the intervention of making referrals to maybe if they need special education classes or other services. Is that included in one of these, the disciplinary or the instructional or behavioral?
Yes, that should be included in the SBAR level responses and crosswalk. That is actually a link, and that should be included in there because that does follow the state. The state has also made those recommendations as well.
And would it be looked at for level 1? I mean, when can we, the earlier we can identify any needs, the easier or the less frustrated the student is and the teacher if the student needs other services.
Yes, so it should be listed by the levels. If I'm not mistaken, I know for certain it is there for level 2, but it should be listed there by the levels of where that recommendation could take place.
Thank you.
Thank you, Dr. Carter. Any further, Dr. Brennan?
Ms. Foster, thank you for that presentation. That was a great overview and very helpful, very instructive. We've talked in the past about the concept of restorative justice, which sounds like we're sort of inching towards, particularly the idea of asking what harm was caused, what caused the behavior, the involvement of families in the discussion. Can you, just from my own education, could you or Director Brown help me with what the difference between this and restorative justice is?
It's very similar, and it's coming back around. The state of Virginia has now recognized that this is something that does need to be included when we're talking about alternatives to suspension. Mm-hmm. Because at the end of the day, this is what SBAR is. We're talking about alternatives to suspending a student for a certain type of behavior. Mm-hmm. So this is very similar, if not inclusive of restorative justice.
And so we use restorative justice practices as strategies when we're doing interventions and preventions. And so even if it's small groups for circles, if it's mediation that's needed, we can pull and use certain pieces of the restorative practices that's embedded within our interventions that we have.
That's great. Well, thank you very much for moving us in the right direction.
Thank you, Dr. Brennan. Any other board member have any further? I'm so sorry. Go right ahead, Dr. Nilles.
Yeah, I guess in general, I felt like our approach to student discipline was very conservative in terms of we went to a lot of effort to make sure kids got the support and intervention, and we were looking at the behaviors in the classroom. And my time on student discipline committees, didn't strike me as being just kind of run them through the routine pipeline and give them an automatic suspension. The behaviors were pretty significant. When I look at, say, a couple of the categories, like BES 012, which is striking an administrator without harm, And that's, I guess you're not allowed at that point in that particular incident to refer that to law enforcement. And I wonder if, if I went out on the street and struck somebody without harm, would I be held to the same standard? So and there's another one in the same category, BESO10. It talks about gang-related behavior, which is not doesn't rise to a level 5. And I have some personal concerns about that. I don't know if you are comfortable with all the categories or not.
Yeah, so these categories are via the state. So this is DOE guidance. We are, as school divisions, are just following the guidance and implementing the interventions and preventions that we have at our capacity in each school division. So what you're seeing is what every school division, all 132 school divisions, will be following effective this upcoming school year. There are some that are currently following it now. Henrico County is one who I have been in quite a bit conversation with because they are doing it this school year and learning as they go. So what you're seeing is VDOE guidance.
Well, there's guidance and there's guidance. I don't know what our interpretation of guidance is.
And Dr. Nellis, I would go back at every school board meeting, discipline committee meeting, we always look at each incident case by case. And I always ask, what is the intent? Was it malicious? Was it to maim, hurt, harm, and if so, to what severity? And then also, we look at the child as a whole. We look at the family as a whole. We also look at the victim, if there is a victim, as a whole. And we use all those things to make the best recommendation for any of our students that we have. And I would hope that the disciplinary committee will still hold that same philosophy with having all information, academic behavior, attendance. If they have an IEP, having that information as well, and make a decision based upon all information that we present at that time, and we do it on a case-by-case scenario.
And I appreciate that, and that was one of the things I was very impressed and frankly proud of when these cases came before us for the committee hearings. My concern is that we may not be able to fully take into account the personal circumstances with these categories, and that there's an automatic. I don't know. It's automatic in some cases in what you can and can't do. You're automatically limited. There might be a need to go further, and that's where my concern.
And then at that point, we will have the conversation with the superintendent. If we need to bring it to the board at that time, we will bring it to the board, Dr. Nellis.
Well, I guess my concern is you won't be able to do that in some of these cases.
I think we still want to do our due diligence, every child by name and by need. And I hear what you're saying. It's guidance, and I'm not going rogue here and not following, suggesting that we are not following VDOE guidance and other information that we get as a school division, because we are obligated to take all of that in and plan accordingly. But I think what Director Brown is saying is that, first and foremost, we are a child-friendly institution. We look at children first, and we try our best to understand the circumstances surrounding any situation. We will continue to do that.
All right, thank you very much. And I want to make sure that all board members can hear, and so we may need to renegotiate the mic, Director Brown.
Yes, sir.
But thank you, very clear responses. Dr. Sinha.
Yeah, thank you for your presentation, and I appreciate that you had it available on board docs so that we could follow along. One thing I'd like to see at some point, and we've talked about this plenty of times before, is just patterns of behavior, predictors of behavior, patterns in teacher reporting. For example, do you look at teachers who seem to be struggling with classes? I know when I was in school, there were teachers who could command a class, and not necessarily because they were strict or frightening or whatever. They just had a presence and they were able to control a classroom. And then others, for whatever reason, couldn't. So I'd like to hear a little bit about what you do in terms of training teachers initially, and then ongoing review and training and practice. And then what kind of, I know you capture all this data because we get a wealth of information when we review cases during our discipline committee hearings, but I think it would be, I would like to see some analysis of patterns or predictors or things that might provide some insight into early indicators of potential problems down the road, and how we might go about intervening in those cases or bringing circumstances to bear. And I'm really grateful that we do take the time, and it's you, Ms. Brown, who really deserves kudos for this, to really look at the student, examine their experiences, look at the mitigating factors, look at what they're up against in their home environment, school environment, whatever it may be, and to show compassion toward our students. I think that's a very important thing we need to remember with children. They may be 18 for our oldest students, but impulse control is still a problem, because they're not fully formed adults until mid-20s. So I wouldn't want one bad move or bad impulse to chart a course for a person's future. But just the same, so what kind of training do you do mid-course for teachers and staff, and then what type of analysis do you do with the information you collect?
And so I'm more than willing to come back to another workshop and have my team present on that. At the beginning of the year, for new teachers, all new teachers, our board certified behavior analysts conduct training for all new teachers in regards to classroom management 101, that I love to call it, but Mr. Ferguson gets me every time that I say that, because it's way more than that. We do engaging instructional practices to deter inappropriate behaviors during that training. And as a follow-up throughout the year, he checks in with those teachers to see what additional supports that they might need. Do we need to do more of that? Yes, we do, and that's why we're trying to grow the staff that we have, so we have more feet on the ground for check-ins with our staff, but also trying to build the capacity at each school to have teams to be able to train each other using the train-the-trainer model on behavior techniques. Also this year, we have our Google Classroom that was created, in which principals and teachers, correct me if I'm wrong, has access to it, and they can watch videos in regards to strategies, effective strategies to deter different levels of behaviors or different classroom inappropriate behaviors at that time. So in regards to professional development, it's ongoing activities, whether it's videos. We haven't had that many live in-person professional development just due to COVID, but we are working to build some professional development training that's ongoing throughout the year. In regards to data, each of the schools review their office referral data, and they can disaggregate that by teacher, by class, by location, by grade, and that information, we recommend that it's reviewed at the end of each month, and we need to do a better job, and I'm going to be honest, with working with our principals and administrators with disaggregating that data and going through that data and making sure that they are making data-driven decisions that's in the best interest of the school as a whole, based upon that discipline information. So that would definitely be a grow for our office for this coming school year.
And Dr. Sinha, in one of my weekly updates, I think I shared one of the videos that Ms. Brown is talking about. We looked at antecedent behavior, just so that you would get a snapshot of what the training that goes on via video.
Just to comment, I also concerned a little bit about inherent bias, and my example there is I'm a northerner. It took me a long time to get used to calling women ma'am, and I'm sure I seem cold and rude in my northern ways, and it's just, I didn't mean to be that way. I'm just not used to southern way of doing things. Now I am, but those kinds of things, cultural differences, subcultural communication styles can lead to misunderstanding. So I hope there are things in place to help our teachers and staff with that. We have a very white workforce that's quite different from our student body. So that I think there is a lot of potential there for those kinds of misunderstandings to happen.
Thank you, Dr. Sinha. Well said. And of course, we can have further discussions on this, but I think you all have adequately helped us to appreciate SBAR and its pending implications. And thank you very much, Director Brown and Foster, for your sharing on that matter.
Thank you.
If there's no further discussion from the board, we will now move to the next item. And this is another ongoing piece, but SRO presentation. Dr. Edwards set us up for that.
Yes, and Mr. Gatsky is going to join Director Brown along with Officer Ramirez, one of our SRO officers, and I tried to give you a preview this past weekend of just a few of the things, small, that our SROs do in terms of them being part of the family and the network of our schools, but I will turn it over to Director Brown and Mr. Gatsky and Officer Ramirez to share more with you.
Well, good evening.
Good evening. Good afternoon.
I would like to start off by making sure that nobody's misled, even though I was listed first on that slide. The work is done by Ms. Brown and the SROs. I actually just joined the group in November, and I'm still kind of learning my way. How do I go? Despite the pandemic, the SRO committee team has been working throughout the pandemic. We've met almost monthly through the year. You can see there the different meeting dates and the topics. I would like to point out that in March, we did have an overview that was presented to the police leadership and the school leadership, Dr. Edwards and her team, and then also the police department participated in that. And that is an annual requirement of our MOU, along with actually the monthly meetings and whatever. In April, we started discussing what we're going to do for the summer, and that's what you see under the topics for April. One thing we are excited about is that the police department is working on a video training on school safety and topics of that nature that they are interested in educating us about. We're also looking at the school safety walkthroughs and all of that kind of stuff. It's all annual walkthroughs and inspections and all that, and they also help us with our internal school safety audits, and that will be coming up this summer also. This next slide is just what our recent data. The SROs do a monthly report, and what you see here is the different categories of incidents from 2017 to the present. I will note that on the last column, the 2021, That is the data that has been reported since January. Because of the pandemic, we did have a gap in data reporting. So that those numbers there are for from January to present day. That's all.
Ms. Ramirez and I are over here fighting over this slide here, but I have Officer Takis online to kind of help me out. The SROs in Lynchburg City Schools work collaboratively when we're doing projects and just meeting the needs of the students. And this slide right here, we have Ms. Hanson, a teacher at EC Glass, who worked collaboratively with Ms. Ramirez. We needed to find a solution to notify the fire department where our students were in buildings that were 2 floors or more. So the solution that we came up with was to have a sticker for the fire department to recognize, to know that in case they had to break that window or bust it out, in the case of emergency, they would know the location of our students. So thanks to Ms. Ramirez and Ms. Hanson, we were able to create this emblem working with the fire department. And Ms. Ramirez has been placing those emblems throughout the schools from Lynchburg City Schools to ensure the safety of all of our students and staff in case of emergency in buildings that have more than 1 floor in that building. Officer Takis, he is one of our SROs, and right now, I like to applaud him because he's actually at Andrews Air Force Base on deployment. And I would like for him to just talk a little bit about how, he's done some collaboration in some of the other SROs in the unit with LCS.
Hi, everyone. Can you hear me?
Yes, sir.
All right. Thank you very much for having me. I'm sorry I'm not there in person. I'll be back in just a few weeks. Other things we do as SRO to collaborate with the community, in addition to that window sticker that they're working on with the fire department. All the doors of all LCS buildings are numbered for identification purposes. We have just finished a project where now all those door numbers and schematics are uploaded to every mobile computer, all of their Lynchburg Police Department patrol vehicles. So if they need to respond to a school and a certain door number is identified, they don't have to run around the building counting doors. They can actually go directly to the door. So we were able to collaborate with the SROs, work all together to get all that information. We worked with GIS, downtown, IT. I believe I reached out to Mr. Gatsky as well to get some of that information. Other things that we do in the community, we've done I believe it was recently, I think Dr. Brennan was there with us for the Dunbar. We went out and did the 20 book challenge where students were nominated by their teachers. They got a prize backpack, like a swag bag with things stuffed in there. We reach out and do things like that. We do the bike drive with One Community, One Voice, the fire department, the sheriff's office, where we distribute brand new bicycles to students that are identified, I believe, by their teachers as well. Some other projects, I do Takis Talks. That was actually brought up, put on the news just before I left for Qatar in 2019, where I do interviews with different people around the police department, different professions, kind of giving some information to students that may be interested in law enforcement or a different aspect of law enforcement. We recently interviewed Katie, the fraud lady. She works at the front desk at the police department in a civilian capacity. Other things in the community, we work with our CAT team, the community action team. They coordinate with Parks and Recreation. In the past, we do barbecues. They do like pop-up cookouts, things like that, where they go out to community centers with Parks and Rec. They recently went over to James Crossing and had an event over there. We're a little all over the place. doing what we can.
Thank you, Officer Takis. All right, next steps moving forward for this group. We're going to continue to seek principal, student, and community parent input before determining the status of that SRO program. We want to make sure that we're providing quality service. So what does that mean? We'll continue to survey our parents, our students, and community to get feedback to see how we're doing. We'll continue to work with LPD to learn terminology, jargons, and also making sure that we're staying abreast of the gang language. So reviewing civil versus criminal arrest codes as well, making sure that we are separating a school incident versus what's a criminal or civil incident within the state codes. Being mindful also that we are honoring the MOU, making sure that we are reviewing the MOU frequently, and making sure that we are collecting data, analyzing that data, but also being specific and creating some strategic goals for that next school year. One thing that I like about working with the SRO unit is that we are able to track our students that are runaways. We're having immediate notification to assist to try to find our students. And even working with our gaggle management system, when we're having some alerts that comes across it, it's our own SROs that's going out to our students to do that wellness check or that first line of intervention. It's usually a face that they have seen or are familiar with, and that decreases the anxiety, and that leads way for real conversations in which we're able to get the students intervention and the support that they need. And that's just some of the next steps. In regards to community policing, Officer Takis talked a little bit about that and some of the collaborative things that the CAT team does within the community. Officer Fink leads the TAC team, and right now he's away on vacation. But I would like to just emphasize that that CAT team works with Lynchburg City Schools, one community, one voice, the Sheriff's Office, and other community agencies to provide positive supports for the community. It takes a team to do this. And so, in regards to public safety, they're coming out and saying, hey, even though we're police officers, we want to let you know that we're human too. We want to build positive relationships with you. And guess what? If we have to involve your school employees, the faith-based community, or what other resources we need to come into your community to say, hey, we're here for you, we're going to do that. And so that's what the CAT team's been doing this year. To sum it all up, this year, the SRO MOU was revised, and as of January, LCS has been implementing that MOU alongside with the Lynchburg Police Department, especially the SROs. We're making more of an effort to work hand in hand to be proactive and to provide interventions and diversion programs for our students, all while maintaining public safety and school safety for our students. So moving forward, you will get more detailed reports and more data from this committee as we focus on school safety, which will include some mental health, some social emotional, and also looking at behavior supports that we are doing with our students. So, do you have any questions?
Thank you, Director Brown. Any comments, Dr. Gupta?
Thank you very much for your presentation. Officer Ramirez, could you come in between so I can see you?
Yes, she's been hiding. She didn't want to talk tonight.
How are you doing, sir?
You know, I wanted to thank all the SROs working in our school system, but especially your enthusiasm and your passion is contagious. So a professor and me will ask you a quiz question, and maybe you can tell the school board the answer. So what to do when the PA system goes out in the senior night announcements?
Again, it's just one of those things, man. We talk about community partnerships and, just being proactive, SROs aren't all about arrest. It isn't. We're there to build partnerships and build those relationships and make memorable moments with our students. It was one of those things, power went out, everything went hectic, there was panic, and I drove my patrol car up on the field and said, Miss Mason Cup, my athletic director, have at it. Here's my mic. Make announcements and let's announce our senior students and give them the love and the praise that they deserve to end their school year for their senior night in the band program and as far as the football team as well. But it's just one of those things, man. I've been so grateful and honored to be a part of this unit, and it's been such a humbling experience. But I really thank you guys, and again, I want to thank Officer Takis because, again, whether you guys think it or not, we're on the clock almost 24/7, and we take our own time to come in, even after hours, to support our students or help Ms. Brown with all calls, and just, we're really working hard just to continue to give you guys the support that you guys need to follow up with students and make sure that they're nice and safe and they're doing their schoolwork and showing up to school. So, but I thank you guys, and thank you, sir.
So you improvised and you came to the rescue that night.
Yeah.
So we applaud.
Yeah, thank you, sir.
Thank you.
Dr. Coleman?
Yes.
If I could share one last thing. And Dr. Edwards, I don't know if you want to share what happened today.
You can share.
Okay. Today at one of our schools, one of our students stood up abruptly, and they had a panic look on their face, and they were choking. And the closest staff member to them, notice I said staff because they're part of us, was the SRO. And the SRO did the Heimlich maneuver today during lunch for that student. And just the look on that SRO's face and that student's face when it was finished, and he let that student know, it's okay, I got you, was priceless. And for me, SROs is not just about patrolling and creating that safe environment in school. It's about that relationship and that bond that they're building day to day with our students and letting them know that I am here for you. And that's what stood out today. And that's the why we have our SROs here for Lynchburg City Schools.
Wow, what an amazing story, and I'm so thankful that you would share that. And that's amazing. Thank you so much for that.
Thank you.
All right, I would just like going forward with the SRO detailed monthly reports, Mr. Gasky or whomever, that somehow we would be able to disaggregate this information around subgroups, that we could have that type of information going forward. We thank you so much for the report. If there's no other questions or discussion from the board, and if the stamina of the board would endure, we can go on to item 6 and maybe even 7 without a break. Item 6, School Health Advisory Board.
And at this time, I'd like to introduce Ms. Sherry Brown. She is now leading our School Health Advisory Board, and she will give the report out.
Good evening, Board. In the spirit of what you just heard, I would like to say that I'm the newest member of the Student Services Department, and I too am grateful to be a part of this department. The Health Advisory Committee met on January 27th of this year and also on April 14th of this year. During the January meeting, the following was discussed. COVID vaccinations and implementation by Lynchburg City Schools, Office of Student Services, and the nursing team was discussed. At that time, they had vaccinated over 300 LCS and Lynchburg City employees and were planning additional clinics. Mrs. Morris, the Director of Nutrition, discussed meal distribution for hybrid and remote students. Meals were being served in school, taken home by students, and curbside service was offered 3 times a week. Grant money was utilized to purchase a delivery van to assist with home deliveries for families who lack transportation, and those deliveries began on February 2nd of 2021. In addition, Mrs. Morris reported that Food for Thought would be handing out 20-pound boxes of fresh produce and essential items once per month. SBAR, which is Central Virginia Addiction and Recovery Resources, we received a grant update. Janua Davis provided that update, and she is with Horizon Behavioral Health. 914 out of 1,800 8th, 10th, and 12th grade students participated in the Youth Risk Behavior Survey electronically in December of 2020. We are currently waiting on the results to return. During the April meeting, we discussed the following. Nurse Coordinator Andrea Bryant reported that all LCS employees who had answered the survey to request to be vaccinated had had their first vaccines. The second doses were due to be given 3 days later on April 17th. Only those who wanted to wait for the Johnson & Johnson vaccine at that time were left to vaccinate. LCS employees and many members of the Office of Student Services continued to volunteer at the vaccination clinics. Mrs. Morris, again the Director of School Nutrition, reported that they were adjusting to students returning to the buildings and were working on a summer food program with Lynchburg Parks and Rec, the YMCA, and Boys and Girls Club. Curbside service is expected to continue this summer on Mondays, Wednesdays, and Fridays at Lincoln Middle School and both high schools. Instead of assisting with after-prom parties this year due to COVID, the SBAR group purchased every upcoming LCS high school graduate a yard sign with their school name, logo, and graduation year. Some of the students have already started putting those signs out in their yards. A subcommittee was formed from the Health Advisory Committee. A subcommittee was formed, and we're meeting to look at the preliminary results from the December 2020 Youth Risk Behavior Survey. Once those final results are in, we will be back to present to you what those findings were. And then lastly, on April 27th, Dr. Bradley Bryant of LCS reported on the family life curriculum, the professional development that was being completed. During this school year, 27 elementary teachers received professional development. And then during the 21-22 school year, middle and high school teachers will be offered the same professional development. We have our last meeting for this school year, which is set for May 26. And that is the end of my report, short and sweet.
Thank you, Ms. Brown. The floor is open for thoughts from the board or questions. All right.
Thank you.
Thank you so much, Ms. Brown, and might the good work continue. Thank you for everything. All right, Ms. Evans, the show is yours at this time.
Okay. We met, I don't even remember, last week with the committee, and we've tried to look at this committee on how we can go about getting everybody on the board involved in it. If we want to make change in education, we've got to know what's going on in Richmond and be active in that part. And so we were trying to think how we could get everybody involved. And when we had to do the breakfast via Zoom this time, because we had to, we kind of split up our agenda, and everybody took a section and kind of spoke to that section of the agenda. So what we were thinking is everybody sticking again to one section that they're interested in and kind of being responsible for that throughout the year. So if legislation comes up involving, as Kim did, early childhood education, if something came up for that, that's really her area, and she would let us know, hey, there's a bill being introduced, we really need to support this, you need to email your legislator, we need to do this, this, and this. So everybody would have a piece of it, and that would be your area to focus on and report back to us, and it wouldn't have to be at every meeting, and it wouldn't have to be at a meeting. It could be an email to the board saying this is going on, but we thought maybe that would be the best way to get everyone involved in doing this, because it's critical that we give our voice to what's being passed for our students in education. We have to be, I think, more involved than we have been, and let them know, yes, we like this, no, we don't. It's important to do that. So what I'm hoping from here, and Dr. Brennan, I think you said the summer, we re-look at this agenda. So once that piece is done, my thought is, let everybody look at the agenda after we've kind of decided what it is. Once we all agree that this is going to be the agenda, then we can split it up and you can take the part you like. Like I gave you just this past year's agenda, but we're going to change that this summer. So once we get the new one, everybody would get this and really pick an area that you feel passionate about and that you want to follow up with. So that, as a committee, is kind of what we came up with, of being the best way. Now, the chair would still go to the Capitol Conference, send out things like that, and do all that. You wouldn't be asked to do anything but really the one area. That way we can all keep updated in every area. So I'd love to hear anybody's thoughts on what y'all think about that.
All right. Ms. Morrison.
I really like that idea.
Good.
That we kind of develop an expertise. It's hard to do it all.
Right.
So if we kind of pick the area that we really want to focus on, I think that then keep up with what's current from VSBA and from Richmond and Washington.
Right.
I think it's a great idea. I look forward to it.
Great.
Thank you, Ms. Morrison. Dr. Brennan.
Just as a committee member, I want to just thank Ms. Evans for bringing this up. I think 2 years ago when we designed this agenda for the first time, it was a step in the right direction, but I think this is taking us to another level of really trying to have more ongoing evaluation of the different items and the board to be more involved in it. So thank you for doing that, and I think it's a great idea also.
Thank you, Dr. Brennan.
Real quick,
Go right
just so
ahead.
everybody knows, this was really Kim's idea of how to kind of split it up, and I think it was a fabulous idea. I'm just explaining it, but she
You didn't
really
have
owned
to
that
do
idea.
Just a messenger.
Thank you for your input, Dr. Sinha. Thank you, Ms. Evans. Any board member would like to speak to this matter before we move on? I sense an agreement, Ms. Evans, for us to proceed in the manner in which you have put before us, and we will govern ourselves accordingly as the summer unfolds, and you'll bring something back to us.
Exactly.
And give everyone an opportunity to participate in advocacy around your particular area of interest or passion. All right. Well, excellent. My, Dr. Edwards, it is 6:31, and we are at the informational items, and all of our board members can read, and so you see all of those particulars. I do want to pause for just a moment while we're there and thank Dr. Danny Rule and the entire staff here at Dunbar Middle School, and I think board members can clap for them. And we've had a wonderful, wonderful time here, but please recognize that the next time we meet as a full board, Finance Committee, is the venue established for your meeting, Mr. Harvey?
Not yet.
Okay. Well, as far as the school board meeting, we'll be moving to EC Glass, so please help each other. Don't come back here. You might have a little.
I'll text somebody.
Yeah, go to Glass. All right, and that will be in the auditorium, the staging area. And Bell's group has, I identified here, and then the next work session will be, of course, at Glass. And so that takes care of that. We do want to acknowledge that these appreciations are going on, and the Paramount and Glass piece was wonderful today, and all of the efforts of the board. Thank you so much. The Paramount Gym dedication is tomorrow at 10 a.m. Is that correct, Dr. Edwards?
Yes.
Yeah, so anybody would like to get over to that, and we know that there are always more discussions about other gyms at Heritage and et cetera. And please make sure that if you have not already, turn in your summative evaluation to our board clerk. And unless there's anything else before the board.
These materials that we have before us.
Yes, concerning the Law Regional Program, I think this is information items, the annual financial report, comprehensive annual report. Please make sure you take those things and make it for interesting reading tonight, since we're getting ready to leave. All right? If there's nothing else to be reported tonight, this meeting is adjourned, and govern yourselves accordingly. Thank you, everybody. Meeting adjourned.